Well, the record virus caseload right now has health experts here in the Lehigh Valley making a plea to the public.
And so with that in mind, we turn now to Dr. Timothy Friel from Lehigh Valley Health Network, an infectious diseases specialist. He is joining us live. And Dr. Friel, we're seeing you again as we had back in the spring several times. LVHN reached out to us tonight. Normally it's the other way around. So that sounds like you guys must be pretty concerned. Are you, and why?
Rob, thanks for having me. It's unfortunately, it's important for us to be back here. We've been with you from the start of this pandemic, really working with our community to help understand what we're up against. And now we face ourselves at a critical crossroads. We have seen significant increases in COVID-19 activity across the entire region we serve in the last 2 to 3 weeks. In the last 10 days, we've seen almost a doubling of the number of patients admitted to our hospitals. In the last several days, we've seen almost all-time sky-high record numbers of newly diagnosed patients throughout our region. So as we head into the holidays, it is critical for us to raise the alarm that people within our community need to come together, need to step up to the plate so that we can slow down the spread of this virus, stay on top of things, and do everything we can to prevent our hospital systems from becoming overwhelmed with COVID-19.
I think that's what people are most concerned about, the hospital systems becoming overwhelmed. What are you seeing? How close are you to a really concerning level of patients there?
So, Wendy, it's a fantastic question. And, as of earlier this evening, we've hit about 190 patients across all the hospitals that we see. And that includes all of our adult patients in medical surgical units and intensive care units at all of our campuses. If you throw on top of that patients in our inpatient rehab units, our transitional skilled units, and some of the other places we serve, that number comes to closer to about 230, 240. Our peak in March was 264 patients at one period of time. We right now within our hospital have 120 patients who have been admitted to our hospitals who still have the results of their tests not yet back. So if we assume anywhere from 20 to 25% of those patients are positive, we will be over our record numbers within the next day or so. So for us, this is really, really important. We have learned so much about this infection since the start of the pandemic. We are better prepared to take care of folks, but the thing that frightens us most at this point is getting to the point where there is not appropriate room in our hospitals and the other hospitals across the region to bring that exceptional care to folks.
And Dr. Friel, I know the model out at the University of Washington said Pennsylvania in December could go from 7,000 daily cases, as we've been seeing this week, to 20,000 plus, and said that the hospitals in Pennsylvania, certainly not across the board, but many of them would run out of ICU beds. Running out of ICU beds is not something that we seem to have gotten near in the spring. Could that happen here?
Correct. Yeah, so it's certainly one of our biggest concerns right now. We were able to successfully avoid that in the spring, and we hope to, if at all possible, do so. But this is where we need the community right now, I think, to step up to the plate. I want to reassure folks, we have a plan. We have a plan to make beds available, to provide exceptional care to folks wherever and whenever they need it. However, to do so, we really need to do our best to flatten the curve. It's that same thing that you and I talked about when we first met back in March. We talked about this principle of flattening the curve. This is a highly infectious virus, and we need to do what we can to avoid unnecessary transmission from person to person to keep those numbers at a controllable level. We have options for therapy. We have great options for care for those who are the most sick. But we want to make sure that there's proper space, there's proper equipment, and there's all the needs that are necessary can be given to those individuals. And that's why, again, I turn it back to what can our community do at this time. We're heading close into Thanksgiving. Thanksgiving's a time of the year. It's one of the most important holidays for many of us. It's a time when we acknowledge all the great things that we're grateful for, that we appreciate, and we're thankful for. But I think at this time, what I would ask for folks who showed such great appreciation for the healthcare systems in the spring, this is your chance to give back and work and stand with us in our efforts to quell unnecessary spread of this virus as we move forward. So what does that mean? It means stepping up to the plate. It means wearing a mask. It means social distancing. I think we're at the point, I have my mask right here. We have to stop looking at this and calling this need to wear a mask is something that's being imposed upon us. I would like to see this as our badge of honor that we're wearing right now. It's a tool for all of us to control infections. Social distancing is a shield that we can all use. By doing these things and putting these things in place together, we step up to the plate. We take accountability and we do our part to curb the unnecessary spread of this infection throughout the region that we live in. We're doing this for ourselves. We're doing it for our communities. We're doing it for our loved ones who we don't want to get sick. We're doing it for all the businesses we want to keep open. We're doing it for all the students that we want to keep in school. This is our call to arms right now, and we really, really need the community to listen and to do their part.
Dr. Friel, thank you. We can obviously sense the concern and the passion in your voice, and we appreciate you joining us tonight to bring us this message. Time for the Lehigh Valley to really step it up, and thank you very much again for being with us tonight.